These are the 6 things that move the needle the most, that improve your longevity and your health span. Hello, I'm Dr. Mike Brooks. I'm a medical doctor specialising in emergency medicine and worked in the NHS for 14 years. And recently I've become interested in longevity. And what I've done is I've gone through all of the longevity and health span interventions that you hear online. I've looked at the medical evidence and I have ranked everything on a 5-point scale of proven, promising, uncertain, disproven, and harmful, to try and get some sense and compare to what you hear online to what the actual evidence says. The 6 things that mostly move the needle. 6 is type 2 diabetes management and detection, and that is checking your blood to make sure that you're able to keep a lid on your glucose levels, and where you are losing the ability to do that, doing lifestyle interventions like exercise and diet, but also taking medications to reduce your blood glucose level. It prevents knock-on problems like heart attacks and strokes. 5 is obesity management. So that's where you measure your BMI or body fat percentage, whichever one you prefer. And if raised, you reduce your calorie intake, so go on diets, you do exercise, and if necessary, you take medications that reduce appetite, such as GLP-1 agonists like semaglutide or tirzepatide, also known as Wegovy, Ozempic, and Mounjaro. And in more extreme cases, you have surgery that reduces the amount that you can eat. This helps prevent a whole host of problems ranging from heart attacks, strokes, arthritis, sleep apnea, can even improve your mood as well. 4, smoking cessation. So this is getting off tobacco and staying off tobacco. Tobacco damages your DNA, but it also damages your blood vessels and your connective tissue, causing cancer, problems like heart attacks and strokes from blood vessels, but also the appearance of aging because of the connective tissue damage. It is the leading cause of avoidable mortality in humans, and there are medications that you can take to reduce cravings. There are nicotine replacement products so that you can consume your dose of nicotine that your body craves without nearly the damage that you get from smoking tobacco. And the result is a dramatically reduced risk of these other diseases. Even later on in life, there's always a benefit to doing it. 3, exercise prescription and optimization. In the Western world, people don't move enough. The problem with not moving enough is that you get muscle wastage, your skeleton thins out, you get less good at balancing, which is important as you get older, when falls become a particular risk. Also, not doing exercise can actually reduce your mood, make your mood worse. And most things about the body are use it or lose it. And when it comes to the physical domain, absolutely exercise, this is true. What this involves is doing 150 minutes or more of exercise a week, ideally a mixture of cardiovascular stuff, aerobic stuff, and resistance stuff, weightlifting or some other form of training against force. For older people, also some balance type training. You don't need to be an athlete. You get the most benefit from going from no exercise to going to a moderate level. The more exercise you do, the better. And not only does this protect your skeleton, reduce muscle wastage, improve your balance, it's fantastic for your mood. It's one of the most effective, fastest onsets antidepressants that we have got. 2, lipid management. By lipids, I mean the amount of fat-like substances that circulate in your bloodstream, such as cholesterol and the proteins that carry cholesterol. This involves doing blood tests to see what your levels are like, because very often there aren't any symptoms if you're running high. And if you are running high, going on treatment to lower those lipids in your blood. And doing this prevents damage to your arteries, which means it prevents things like heart attacks, stroke, but also heart failures as well. And number 1, the biggest intervention that you can possibly do is blood pressure management. Most high blood pressure has no symptoms. You don't know you've got it. So the only way you're going to find it is if you have your blood pressure monitored regularly You do a diary for 2 weeks, and if it's high, you do something about it. Yes, exercise and lifestyle can help a bit, but in the majority of cases, this does need medications. There are lots of different medications out there, and they do things in different ways. The odds are there will be something that suits you. The particular choice does depend on things like your ethnicity and your other medical conditions that you have, but this is something doctors are very used to dealing with. And why should you do it? We've got very good data that proves that if you reduce people's blood pressure, ideally down to below 120 millimeters of mercury systolic, but if you can't, 140 millimeters of mercury, it reduces their risk of cardiovascular events, heart attacks, strokes, those sorts of things. And it is the number one thing that will improve your lifespan and improve your health span than anything else. So there you are, 6 things that where the medical evidence demonstrates they have the biggest effect on your lifespan and your health span. And they sound rather boring. Stay healthy.